Hey Doc, I am back with another wonderful guest, my dear friend who I haven't seen in so long, Dr. Rebecca Berens. I want you to tell the listeners who you are, how many kids you have, and how old they are.
I'm Rebecca Berens. I'm a family physician in private practice in the Houston, Texas area. And I have three kids. My oldest is 6, my middle is about to turn 4, and my youngest is about to turn 10 months.
So you are in the thick of it. I
Oh,
love.
yeah.
So the oldest is 6. So you were you in residency?
No, I was actually 2 years out of residency when he was born.
Okay.
And yeah, my husband was still in residency. He was actually, no, he just graduated when he was born, but he was in residency for the majority of my pregnancy. And we were in Philadelphia at the time, finishing up his residency. And then we moved back home for me to Houston 6 weeks before he was born.
Wow. Oh, so
Well, 8 weeks,
cross-country
but yeah.
move.
Yeah.
Still.
This, the,
Very pregnant. I
yeah.
don't think I knew. I'm like, I've known you for a while. I don't think I knew one, your husband was a physician, two, that you were in Philly. Like, do I know you at all? Oh, so that's so interesting. Okay, how was that move?
It was great. So it was coming home for me, and we both went to college together and med school together here in Houston. So sort of home for him now. He's
Yeah.
from Nebraska originally, but yeah. So we were coming home, and he had basically gotten his dream job out of residency, and so we were coming back for that. Um, and yeah, but we didn't know what we were getting into.
What were you getting into? How was it when you came back?
So, when he got this job offer, obviously I was working at the time at a FQHC in Philly. I was a associate site director for my site, and it was a great job. I loved it. So then I was looking for a position down here. And obviously I was pregnant. I found out I was pregnant actually in the midst of the interviewing process, so which was
Mm.
always fun. Looking for a job while pregnant. And yeah, I think I just didn't have a realistic expectation for what kind of job I would want to and be able to do after
Mm.
my baby was born. So it was fun.
Okay, so we're gonna come back to that, but tell me, because I know this comes up for a lot of people, finding out you are pregnant during interviewing or knowing that you're pregnant and going into interviewing. So how soon, if at all, did you tell them while you were in the process?
Yeah, so I had actually completed my first interview, I think a couple weeks before I found out I was pregnant. Maybe not even a couple weeks. It might have been like a week or two. And so, then there's like subsequent discussions and things that happen. So
Right.
I basically told them, I think I was around 9 weeks after I had my OB visit, and it was like, this is likely going to continue to be a viable pregnancy. I just told them because in my mind, I was like, if this is a problem now, it's going to be a problem then. So let's just be open. And if they have a problem with it, then we will look for something else. So that was kind of how I framed it. And they were fine. They were
Yeah.
actually great. I don't think it had any impact on the rest of my interviewing process or working process. And yeah,
Yeah.
so it was fine.
Do you think that's because you were family medicine or just because of the type of place it was?
I think I think partially it was an academic institution, and yes, it was a
Mhm.
family medicine residency. So I mean, family friendly-ish, we can get into that. But I think also, like, it's just something that they've been through a lot of times. And
Yeah.
yeah, in family medicine in particular, there's a lot of women in family medicine. Maybe if it was like a male-dominated surgical subspecialty, it
Yeah.
would have been a different situation. But
Yeah.
in general, I think family medicine is open enough to those sorts of things.
Gotcha. Okay. So yeah, tell me about your unrealistic expectations.
So I'm family medicine. I think you went to Howard, right, for
Yeah.
residency, and I
No,
was
for undergrad
nearby.
and med school.
Oh, for med school. Okay. So I
Yeah.
trained near Howard in DC at Providence, and we did a lot of OB in my residency, and I loved OB, and I was like, I'm going to do family medicine with OB. And my first job in Philly, I was not able to do deliveries, but I was doing prenatal care and doing a lot of care coordination with the MFM department at University of Pennsylvania. So I was still very engaged
Mm.
in OB care. So when I was looking for a job down here, I wanted to continue that. And this job allowed me to continue doing OB. And I was like, oh, yay, I miss OB. I was so excited. So anyway, that was not something that was realistic for me to do. I think first I was coming back to deliveries after having not done them. for like a couple of years. Um, and also just like the sleep deprivation and being on call, not
Yeah.
great.
It's not something you can go back to.
No, it really is not. And I think that, yeah, I think if you continue doing it, you probably are fine. But to not do it for a while and then try to do it again at the same time as you have a baby, who, by the way, my first child was not a sleeper
Mm.
ever. Like, like people think I'm
Oh,
exaggerating. Yeah, okay, he is now. He is now. Yeah, but like
okay.
for the first probably 2.5 years,
Wow.
not a sleeper. And I think people think I'm like exaggerating or something, but no, it was horrific. And I've had two other children now who were not like that, so I know for a fact that it was really special. So, but of course I didn't know that. I didn't know what to expect, and then I had him, and I was like, "Is this how babies sleep? How do people do this? Like, this is
Yeah.
insane." So yeah, that combination was not great.
Tell me a little bit more about this sleep because infant sleep is a big thing for people. So tell me how was it from the time that you brought him home?
So he was a pretty much from when I brought him home. First of all, I'll say this: he was in the NICU for about 12 hours after he was born. He had meconium aspiration, and he had required CPAP and all that. He did fine, but they did observe him in the NICU for 12 hours, and then I was discharged about 36 hours after delivery, which for my
Mhm.
first baby, which I was like, seems
Yeah,
early. But anyway, I had
but that was not
barely,
by choice.
I had no, no.
Okay.
Literally, they showed up at 10 a.m. I delivered 11:52 p.m. So you get
Mhm.
2 midnights for vaginal delivery. So that was my first midnight.
Wow.
Yeah, second
Epic
midnight.
medicine.
Second
Epic.
midnight happens. Lactation consultant is in my room the entire night, pretty much. Like it was going horribly. I had maybe nursed him once successfully. And then 10 a.m. they're like, you got to go. Here you go. Here's your papers. So, which I was a little surprised. I was like, I thought I was going to get like till the end of the day to make sure I could actually feed this
Yeah.
child before I go home, but I guess not. Um, so, it was stressful. And so he was not feeding well. He, had been in the NICU, had been stunned by all of that. So that was an issue. I didn't know how to breastfeed, obviously. This is my first time. And then he also had torticollis. So he actually like had a lot of restriction and a lot of difficulties with breastfeeding that we later figured out.
Mhm.
This is how I ended up becoming an IBCLC, was in
Right.
learning this process. And so anyway, it was a rough start just from a feeding perspective. And so every time he cried, I was like not sure if he
Right.
needed to feed, what was happening. Um, and then, I I think I had not a good expectation for like how babies will sleep. I thought you put them down and they're sleeping and you put them down and they stay asleep. And that's not what they do. But I was like very ingrained in the safe sleep, right? Because in
Yeah.
medicine, we're taught like you have to put them alone on their back in a crib. And I'm like, babies don't sleep like that. I don't know whose idea that was. That's not how they sleep. I've never had a child that slept doing that. So I relaxed a little bit on my sleep practices on my other two, which is how I think those went better. But I was very strict about it with him, and it doesn't work. Fun fact. I think so.
Just a quick segue. Has it changed how you counsel your patients?
Oh, absolutely. Yes. So I went down the whole infant sleep rabbit hole, up on
Yeah.
Instagram at 3 in the morning, trying to feed him, trying to be like, how do I make this child sleep ever? I bought the sleep courses. I read all of the crazy posts. I went down the whole rabbit hole, and then I was like, okay, let me like be a doctor about this and actually look at evidence-based information. Um, and that's how I got to learning the work of James McKenna, which I don't know if you're familiar with, but like,
It's vaguely familiar.
yeah. So basically, there's the Safe Sleep 7, and like being nuanced in your approach to SIDS risk factors in your
Yeah.
individual child and what you're doing. And so in any case, there were a number of situations in which I fell asleep in unsafe situations,
Mhm.
and this I'm sure happens to everyone, where you fall asleep and it's unsafe. And it really, on multiple occasions, could have gone very poorly. And so I think now when I'm counseling patients, I will talk to them about, expect that this is going to happen and put yourself in a situation for the least risk possible. So
Yeah.
not on a couch, not in a recliner, mattress
Right.
on the floor without blankets or pillows. That's a
Right.
great place to feed them, because if you fall asleep holding the baby, the risk in
Right.
that situation is much lower than it is on a couch in a recliner in your bed full of pillows and high up off the ground, all that. So, it's just a lot more nuance, not like you must do this. This is the only correct
Yeah.
way. And if you don't do this, your baby's going to die. Cause I mean, it just creates so much guilt and shame and fear.
Yeah.
And I experienced all of that. So now
Yeah.
I quote, like, this is what the evidence says. Note, realize that not always can you do things perfectly. So what are the ways you can reduce risk?
Yeah. And I think that's really important because so much of how I practice when I was in regular office based practice was influenced by my experiences. And it's one of those things where you say that you don't have to have the experiences to be a good doctor, but then if you have the experiences, you're a much better doctor. Right? Because it is very rigid, like how we are trained and the things that we do. And it's coming from a place of, well, I don't want your baby to die. As crazy as that sounds, like that is really where I'm coming from. But like you said, it's sometimes unrealistic. And the guilt and the shame that we inflict on people is sometimes more damaging.
And this is what leads people to the alternative practitioners who do not necessarily
Right.
have the evidence and the best interest in mind. But if people are feeling so guilted and shamed and afraid to even tell the truth in visits with us, like I've seen people in comments on social media saying like, "Oh, just tell the doctor this." Like, okay, so now we're having patients lie to us out of fear
Yeah.
for us shaming them or calling CPS on them. Like there's so many concerns that people have when they interact with the healthcare system. And I think it breaks down a lot of those barriers if you can be real with people. And I'm very real with patients. Sometimes they ask me for sleep advice and I'm like, listen, I'm not the person. My babies don't sleep. I hope your baby sleeps. I pray for you, but mine, I never figured. Uh,
You did do during the 2 years though. So is it that you just never slept?
yeah, pretty much. That's pretty much, I think, what happened. I don't actually know how I survived. I think in like hour and a half spurts, I would sleep occasionally.
Oh,
But I have vivid memories of this one time when I was on call and I did not sleep 1 second because he was up and then I was getting calls about this patient
mm,
and it was back and forth. And then I had to work the next day because they did not have a post call day for attendings. Um, and I had to have a full clinic the next day. And that was the day I think that day I told them I was like, I can't do this anymore. I can't
right. That's when
and
you stopped
so
OB?
I stopped OB. And then I think within a year, I had given notice that I was leaving.
Sounds about right. So what did you do afterwards?
So, after that happened, I was like, okay, I'm not going to do OB anymore. There were some other factors about that job that also had revealed themselves that I did not love. Um, and I think a big part of the draw to the job had been that I would get to keep doing OB. And since that was
Mhm.
no longer there, I was like, okay, some of these other parts are no longer there's the redeeming qualities are not outweighing them. And also just I think this is everyone in medicine, but if you're in a full-time clinical position, especially in a corporate health system or an academic health system, mine was in a county health system that's attached to the academic health system. Um, it's very rigid. You have to ask off 6 months in advance if you want a day off. There was all the little, like, daycare holidays that they tell you about a week in advance. I was like,
Right.
"I can't go to that thing." And I was like, the guilt was just piling and piling, and so I was like, "I can't work here and have kids, like, I just can't do it."
Yeah.
At least not in the way that I want to have kids. So, the other thing I realized is that, in order to be promoted in this system, you had to attend a certain number of department meetings and do, like, XYZ, extra unpaid activities because that's how
Of
academics
course.
works. And I was
Yeah.
like, I do not want to go to a department meeting at 6 p.m.
6 p.m.
Oh, right, right, yes. I don't know. This is maybe I don't know. None of the other department meetings were at 6 p.m., but the family medicine department meeting is at 6 p.m. And I was like, I am never going to that. Like, I'm just never going to go. So my advancement stops here, I guess.
Right.
Because I'm not going to go to that meeting. Like, I refuse to go to it. And so, just all those little things that you don't really think about or realize if you've never had a position like that before. Um, that it was like, this is not going to work for me. So I looked for other options. I was thinking about it, was thinking about going back to an FQHC, although I was fairly burned out from that type of work by that point. I didn't know what to do. And so I stumbled upon direct primary care again. I had actually heard about it in residency and then stumbled upon it during this time of my what am I going to do with my life? And I decided I would try it. So then I opened my own practice. And then was about like, a little while later. Yeah.
You just opened your own practice, so we're gonna come back to that. So your baby was 2 at this point. How old was baby?
So when I gave notice, he was 16 months.
16 months. Okay, and when in there did you become the IBCLC?
During that process.
Right.
So I would say, I think he was maybe about like 6 or 7 months old when I decided I would start doing it. And the start of the process was, there's on all this online education that you can do to get the required education hours to be able to
Yeah.
sit for the exam. But I think I started it maybe when he was about 6 or 7 months. And then I took the exam when he was probably about 20 months.
And were you interested in that before your experience? Or was it
So
only because
So I was never interested in becoming an IBCLC, but I was always very interested in breastfeeding. And so, like in med school on our pediatrics rotation, I did an elective newborn rotation in addition to regular pediatrics, just because I wanted to take care of babies and moms. And part of that was we got to round with a lactation consultant in the hospital and we're in a So like I had had some exposure to it. And then of course in residency, we did learn some about breastfeeding and some counseling, but obviously very limited and not a whole lot of troubleshooting when things are not working as they're supposed to, because at that point we would call the lactation consultant. And so, because I struggled with it for various reasons, I wanted to understand like how can I help someone who is struggling with this? Doesn't mean I need to always be the lactation consultant, but at least give them a couple more steps between
yeah.
now and then. And so that's why I ended up. And also just having learned from the lactation consultant that worked with my son and just like the reading about what they were telling me, it was just interesting to me. I'm also like a doctor addicted to learning things. We're all like that, I think.
Yeah, that's how I ended up with a perinatal mental health
Yeah,
certification.
exactly.
That sounds about right.
Yes.
So, what can you go into more of the issues that you had with the breastfeeding? Because yes, you were interested in lactation, but I looked at that certification. It's a lot. So to be inspired that much, it must have been really bad. So what are some of the things that you went through? Because I'm sure a lot of people can relate.
Yeah. So, I mean, like I said, he was in the NICU. So when he came to me, I think when he was like, 14 hours old or something, he had not nursed at all. The golden hour had passed.
Right.
We were all stressed out. So latching just alone was not happening. And then, like I said, he also had torticollis, which I didn't really fully understand the relationship between those two things until I started doing the lactation consultant training. But really there was one side that he just could not latch as well as the other side because of the way they have to turn their neck and open their mouth and
Right.
move
Right.
their tissues when he had pretty significant restriction on one side and so really struggled with that side. And actually to this day, I'm on my 10-month-old, that side has not worked for like 4 months. And it's always been like a significantly lower producer because he never was really able
Wow.
to like start it working with the first one. And so it's always been a problem. But anyway, so that was that piece. And then, then I was pumping a lot to try to build up supply because he wasn't able to latch well and empty well and stimulate well. And so then I had to learn all of the troubleshooting that goes into pumping and fitting the flanges correctly and the frequency and the power pumping to build your supplies, all those things. Um, and you would read all these things online and I'm like, is that true? Is there evidence for that? And then I
Right.
start going down my little rabbit hole. So yeah,
Sounds like a lot of rabbit holes that led you to
a lot of
being an
rabbit
IB.
holes. Yes.
Okay. So I don't think I know you as Rebecca Berens with this amazing TPC practice, knows everybody in Houston. I didn't realize that you started this practice when your baby was so young. And I absolutely love that because the podcast episode that's coming out next week at the time that we're recording is about making bold moves and huge moves when you have young kids because they won't remember and XYZ. So tell me about your thinking and like what was your experience around that time, knowing that you had this little baby and then you're going to do this huge undertaking of doing something that, first of all, especially in Houston, doing a private practice is like, whoa. And then at that point, DPC was not as popular as it is now. So that's a big deal. So tell me more about that.
Yeah. So I think knowing what I know now, I would have been a lot more afraid. I was not appropriately afraid. I didn't know what I was getting into, but I was like, oh, it's
Right.
fine. I can figure that out. Right.
Right.
Anyway, so
This is what does this thing.
yes, it is. So I, was just trying to figure out what can I do, and nothing seemed appealing. No employed position seemed appealing. So I was like, okay, how could I work for myself? I'm not dealing with the insurance. I refuse to do it. Like point blank refuse. So then I was like, what are my options? That's how I found about direct primary care. And I had heard about it, like I said, in residency, but it was even more in its infancy then. So
Right.
just connecting with people, got acquainted with the model and the very basic steps to get started. So yeah, he was about so my son was born August of 2018, and I opened my practice in January of 2020, which also is relevant for COVID reasons. But anyway,
Right.
I spent the year between sort of December 20, yeah, I think December of 2018 was when I had that call that was terrible. He was 4 months old,
Right.
and I was stopped doing OB. So I spent the rest of the year figuring out, like, what am I going to do, and researching and learning and preparing. And then I was ready with the basics in January of 2020. And my plan was that I was going to continue working part-time on a PRN basis for the county clinic, to fund the practice as I was building it, and then build the practice. And it would allow me to set my hours and be more flexible and be around for him. He was still in daycare, so I still had childcare covered. And then of course, March 2020, like this is all chugging along just fine. March 2020, daycare shuts down because they have a COVID case. PRN shifts are all canceled from this county clinic because they don't need any outpatient PRN shifts anymore. And now I was like literally home with an almost 2-year-old and pregnant, I found out that same week. And it was just a crazy month. So yeah, and then we just kind of figured it out from there, stumbled our way through.
No, you can't skip over the good stuff. Come on. When you found out you were pregnant with all of these things going on, what was going on in your mind?
So I wanted to have my second child 2 years later. It was always my plan. My family always makes fun of me. I have a spreadsheet of like my life of how I want things to go. And in my spreadsheet, I was gonna have my first 2 years apart.
That's
So
so you. Oh,
I
I
know.
love it.
It's terrible. So anyway, it was on time for that, but
Right.
I was not anticipating that I would have a brand new practice and a pandemic happening. So
I,
it was a little bit of like, I don't know. I don't think I'm allowed to swear on this, but oh,
yes,
you
you
know.
are.
Oh, okay. Well, it was an it was an oh shit. It was an oh shit. Um, and I like told my husband, I think his face was very like, what? But yeah, so, I think at that point I was just like, what else can happen? You know, it's already the end of days, pandemic's here, like it's fine. We'll figure it out. Um,
Right.
and so yeah, I just, did what I could do. I think I had 3 months that he wasn't in any childcare, so I would just get some work done while he was napping. I only had a few patients at that point because I'd only been open a couple months, and everything was going virtual anyway. So I would just do virtual visits with my patients during his naps. I would do virtual networking during that time. I would do, whenever I could. I remember every morning I would get up and we would go for a walk around the neighborhood. I would push him in his little trike thing, and I would take calls with people for networking or whatever during that time when we were walking. Um, and I built up my network of people. I established patients. I think November of 2020 was when my daughter was born, and I think I had 55 patients by then, that I just sort of like gradually built up over the time. And then I think in the summer, my mom worked for a school district or did at the time. And so by the summertime, she was able to help me with childcare. And so by June, I had childcare again, and I was able to work more long hours during the day. And then by the time my daughter was born, we got a nanny, and then I was able to kick back into gear again and do more work.
Right. And what's your husband's specialty?
He is internal medicine and pediatrics.
Okay, so what was his schedule like during the pandemic?
So he is fully outpatient. And he is in a specialized clinic. So it's primary care for a specialized population. So he has 60% clinical, 40% research. And what they ended up
Mhm.
doing was during the pandemic, shifting around their admin slash research time so that each person had one full day that they didn't have to be in the office and they could work from home. So he would work from home on those days. Um, but the rest of the time he was like normal 8 to 5 hours. And there was a period of time where he was on the draft list for, if we need to call in reinforcements to the hospital. So that was scary. Never happened, thankfully, but yeah, he was working his regular full-time hours this whole time.
Gotcha. Wow. I just want to commend you because with your virtual networking, that is something that has always impressed me about you. It's like, everybody, anytime somebody asks a question about, hey, do you know like a super specialized doctor that I've never heard of? Rebecca's like, oh, yeah, this person in this health system. But in your research about DPC, did you really like, was that a thing that it was very obvious that networking in this way was very important and that you continue to do it during the pandemic? Or is that naturally your personality?
I think I mean, I learned so much about how to open the DPC practice in that year leading up, 2019,
Mm,
from people in, honestly, like, Facebook groups, so,
mm,
like, Facebook groups of DPC doctors. So I was networking amongst that group just to learn from them and, learn from their
yeah,
experience, and everyone in that group is so, generous with their time and their resources and sharing their own experience, and their own struggles to help other people learn and start their own practice, and so I met a lot of people through that, and then when I needed help, I would say like, "Hey, how do I do this?" And they would
yeah,
introduce me to someone, and so for me, I feel like the more people I know, the more people I can help and we can help each other, and I
yeah.
just pay it forward. So, like,
I love that.
I've accumulated people over this time
Yeah.
that have helped me, and now I can share with other people. It is I'm like a very introverted, quiet person normally, which is not my personality at all to do this, but it was sort of by necessity because I was in this insane situation and I was like, how can I do this from at my house during nap time? And the
Yeah.
only way was to meet as many people as possible and like talk to as many people as possible and meet people. And that's kind of how the practice was built. And yeah, just didn't have a choice.
I think that is really amazing that you were able to continue to build during COVID. So when did you join EBS? Because FYI, this is how I know Dr. Berens. She is another wonderful member of the RMD Business School. Again, Dr. does not pay me. But
It's
when did you join?
I joined June of 2021. So my
Okay.
daughter was 7 months.
Oh, we're in the same cohort.
Yeah. Hmm.
Right,
Yeah.
right, right. Okay. Gotcha. All right. So she was born in November, you said, right?
Hmm.
How was the difference? I know you said she slept more, but did you notice a very big difference between the two of them? And did it affect you in any way, negatively, positively, having the comparison?
I think she did definitely sleep better, but I think that was because I had engaged in the safe co-sleeping at that point.
Yes.
Um, so it was easier. I think breastfeeding was also easier, but I think also just because like I knew more.
Yeah.
She it was not like there was no issues, but it wasn't anything like what I experienced the first time around. Because I mean, she wasn't in the NICU, like, it just wasn't.
Right.
My labor was worse because I ended up having to be induced with Pitocin, and so my recovery was a little harder, because I had to, have an epidural and all. I didn't have to do any of that the first time around, so it was just a lot more, of a recovery process, but I had help with her because I had the nanny already. So, when she came home, we had family around to help. And then after they left, the nanny was there because she was watching my son. And so I always had help. I was able to rest every day. Like every day, I was able to take a nap. Which with my son, I did not take one nap my entire maternity leave. And so, like, because the only way I could get him to sleep was to like drive him around or push him around or walk him around or whatever. So, like, I never napped. But so, yeah, I was able to just rest more. And I think the other thing that I learned from 1 to 2 was that you have to accept help. So I'm not really a person who asks for or accepts help very well. But I was more willing and able to do that the second time around just out of necessity, one, but also just like learning that, hey, this is a wise thing to do.
Yeah. And I was just about to ask you because during the no sleep of the 2 years of your son's life, I didn't realize that you had no help. Was that a choice?
It's not that I had no help. I had plenty of help, but I would not accept it.
Ah,
Um, so during my maternity leave with him, um, one, again, unrealistic expectations. I was thinking maternity leave, oh, I'll like meet some other moms who have babies and we'll go out on like little walks together or go get coffee or whatever. Insane. No, I was not realizing the need to prioritize my rest. And like people were offering to help, like my in laws were offering to help. My mom was around and offering to help, but like I would be like, oh, no, it's okay. I don't need it. And I was alone a lot of the time, but it was not because I had to be. It was because I thought that was what I should be doing or was supposed to be doing.
when did those ideas leave your mind?
I mean, I think as my son grew, part of it I think was also just like the anxiety of new mom, breastfeeding's hard. And I think this was the thing too, like because breastfeeding was so hard, I was like, I need to be with him all the time so that I can like feed, like learn the cues and learn how to breastfeed and make sure I don't miss a feed. And there was a lot of like anxiety around that. And so I didn't want other people to hold him or go away for a nap because I was like, oh, they're not going to wake me up in time and he's going to miss a feed or we're going to be late for a feed and then my milk's going to tank, that kind of thing.
Yeah.
Um, so that was feeding into a lot of my not accepting help. But I think after that was more well established, breastfeeding was going okay, I was gradually able to accept more help with him. And then when my daughter was born, I was like, you know what? It's not the end of the world. If you go take a nap and someone else holds her, you can still figure out the breastfeeding will be fine.
Okay. And tell me, with that level of anxiety, was that a level where you felt like you probably should have had intervention, or did you?
I was seeing, I actually preemptively scheduled an appointment during my pregnancy with the perinatal psychiatry group at the hospital where I delivered, um, because I had a history of depression and other issues, and I was like, I'm the person that's gonna have a problem. So I scheduled an appointment with her, and I did see her for several sessions in the postpartum period, and then she referred me to a therapist after that, who I actually still see, it was like 6 years later. Um,
Nice.
so I was seeing someone, and I do think it was a pathologic level of anxiety, but I think it's one of those things where it's like I have enough presence of mind to know it's happening, but I'm also, like, trying to educate myself out of it.
Tell
It's a
me what
very
you mean by
doctor
that.
thing to do.
But yes, what did you do? Like, what do you mean by that?
So a lot of my anxiety was very focused around the breastfeeding issue because that was the present issue and the sleep issue. So I was like, oh, I'll just learn everything I need to know about sleep and learn everything I need to know about breastfeeding, and then I won't be anxious about it anymore. Um,
Did that work?
I mean, eventually. I mean, no, and I think it it was okay. I think I recognized what I was doing while I was doing it. Um,
Yeah.
and it ended up being okay. But I at least did not experience like I was more worried about like postpartum depression and that sort of thing. And I didn't really experience anything like that. I just had sort of the more like the anxiety, obviously, around feeding and sleep, and then this kind of like intrusive, scary thoughts that
Yeah.
a lot of people will get. Um,
Yeah.
but nothing that required medication or more serious intervention. I was seeing the therapist and the psychiatrist,
Yeah.
whichever one I was seeing at the time, fairly regularly. So
So I think that's really important to just like sit down a little bit because a lot of people worry about depression. So did I. But I feel like, especially in physician mom circles, it's the anxiety. And you can see it sometimes in the posts in our Facebook groups. Like the anxiety is screaming at you. And I don't even, it's not like if I have a solution, I just want people to be aware. Hey, whoever's listening, depression is one thing and it's serious. But I feel like we are more likely to have postpartum anxiety and for it to be ignored, and especially by our family, because they're just like, it's easy to say, it's your first baby. That's why she's like that. It's, oh, this is how she always is.
Mhm.
Because I felt this is the same thing that happened to me. And it was with my second. Um, and that was nowhere on my radar. Like it was not there at all.
Yeah. And I think I do feel like there's at least more discussion now about postpartum anxiety, but even back then, I don't think it was as commonly discussed. But yeah, I mean, it's one of those things where like, especially when there's a breastfeeding issue, I see every single patient I've ever seen who's had difficulty with breastfeeding has had some degree of anxiety. And, I think, like you said, physicians in general, we're a little bit of more of a high strung group of people, a little more type A. We like things to go a certain way, and that's just not how babies work. So
Right.
we are definitely at risk. And it's easy to not recognize it, like you said, because it's like sort of our personality to start with.
Right. And it's things that are lauded, like, my ability to think about every single situation when I'm on call and somebody's hemorrhaging and literally dying in front of me is the same thing that kept me up and I couldn't sleep, because I'm
Mhm.
like all of these things. And I like that you said about the intrusive thoughts because everybody gets them, but it's when it's affecting your ability to live your life and take care of your baby, then it's like, okay, well, do I need some kind of help? So
Mhm.
thank you for sharing that. So you had the second baby, you accepted the help, which was wonderful. Tell me a little bit more about the nanny, because that's also a huge hurdle for people. Just the idea of having somebody else in your space and all of that. Like, what were your feelings around having a nanny?
Yeah, I did not like the idea, but and I don't think we would have done it if it wasn't for COVID. But it was one of those situations where it was like, you know, being out with from daycare with an illness every other week for a week or 2 weeks at a time, like it's not feasible.
Yeah.
So
Yeah.
there wasn't really a way around it. Um, and it was one of those situations where I was like, I don't have a choice. I just need to do it. And it was expensive and it was stressful to find a nanny. And there was a couple times where I interviewed several people. We had someone come for a trial one day who was like horrible, and I was like, "Oh my god, how am I gonna find a person?" And then I got so lucky, I found this amazing nanny, and she was with us for almost 2 years.
Mm.
Um, and she was wonderful. She was actually had previously been with a physician family she'd been with their youngest child from birth till age 5, and that child was starting school, and that's how
Yeah.
so, yeah, it was a great fit, but, yeah, it was definitely a struggle to get there, and it was expensive. And that was hard because I wasn't making any money. But I was also like, if I don't have the childcare, I can't build the
Right. You
practice to
can't
make
make
the
the move.
money, so I have to do it. So that was a hurdle, but yeah, it was one of those things where it's just like, this is just the investment you have to make to be able to keep going. And it was great. She was wonderful. My kids loved her. We still talk about her, still share birthday photos and things, and, yeah.
Yeah. So why did you part ways?
When we moved, so we used to live in the city and then we moved out to the suburbs. Both of my kids were going to start at a Montessori school. My son was, he was like the typical COVID kid who like never really got much interaction. And I was like, it was starting to become a problem. And I was like, we need to get you into school. And I really could not afford to pay for school for one and the nanny. That was absolutely not going to happen.
Yeah.
So we had to part ways then.
Yeah.
But she did go, I think, to another physician family, so
And so I want to highlight two things that you said. That you eventually found somebody that was, I'm assuming it was a referral.
it was actually from a Facebook group. Yeah, we have, like, a nanny Facebook
Perfect.
group. Mhm.
Perfect. Yes, because a lot of people like, oh, how do I find like the referrals are the best. Other physicians like post in those Facebook groups. I talk about Facebook groups a lot, but there's so much value there in our
Mhm.
circles. So it's just a good resource, and also that you had to have the help so that you can grow your practice because it's like, yeah, I don't have the money to I don't have the money to pay, but I can't make the money without like having the help, and that can be expanded to other things in general. Having the help allows you to do all the things that you want to do so that you could eventually create your schedule however you want so you can spend all your time with your kids or do whatever it is you want. But it's just, you just have to have the help. There's no
Mhm.
way around it, even if it is expensive, which is why I
Yeah.
have an au pair.
Yeah.
Like, yeah, full time nannies in California is not
Oh,
happening.
yeah.
Yeah. So what made you say, you know what? I want another baby. That cool.
So I always wanted 3 babies.
It's on your
Um,
spreadsheet.
it's on my spreadsheet, yes. This one is a year late, but I was not ready. It wasn't gonna
No,
be 2, 2, 2, like, that wasn't gonna work,
right.
so, I was not ready for that, so we had to postpone a year. So he's 3 years apart from my daughter. But, yeah, I always wanted 3, and I remember, like, my spreadsheet alarm was going off. It's like, "You need to have this baby because 'cause you're gonna be old soon and you can't have any more babies," and it's like, "Okay." And I remember having this thought like, "Ugh, do I really wanna do this again?" Like, I really don't, but I also still want the baby, so, anyway, we had the baby. And he is like a trick baby because he's so good, and he wants me to have
Uh,
another baby, and my husband is like, "Absolutely not." So, that's a
we
problem.
shall see.
We shall.
We shall.
But yeah, he's been, like, such a chill baby.
Yeah.
I think it is partially I am more chill
I was
because I've done this
just
enough
about to
times
ask.
now, and therefore he is more chill.
Yes, chill mommy, chill baby. That's my
Mhm.
new phrase.
It's
Not
true.
healthy mommy, healthy baby. Okay, so we'll see. Maybe there'll be a number 4 on the
Just
way.
kidding.
So you have a 6-year-old and a 10-month-old. What would you have told your prior self 6 years, 5.5 years ago that you wish you knew from all of your experience over the last 6 years?
I think that the help piece is the biggest part is, like, accepting the help, but not just that you need the help for yourself, but also your kids need the influences of other people. And I think there's still this very pervasive feeling or thought in society that, like, moms are supposed to do XYZ thing and the mom is responsible for all these things. But, like, in reality, evolutionarily, even, that's not true. And children benefit from having multiple different caregivers who can bring them, even if they learn different things from different people. And it's actually important for them to have other people in their lives that can't just be you. And if it is just you know, that's down the line not as helpful to them as having the experience of interacting with multiple people. And so I think just accepting the help for yourself, but also for your kids' sake to have the other positive influences in their life.
And I love that perspective. You were the second person to say that during one of my interviews, and I hadn't heard it before she said it. And it's so true and it's so obvious. And I love that you're saying it as well. So hey, you heard her. She does a lot of research.
So
So it's true. So listen. All right. So as we wrap up, we talked a lot about your practice kind of tangentially, but tell the listeners about your practice and everything that you're doing now.
Oh, yeah. So my practice is a direct primary care practice in Sugarland, which is a suburb of Houston. We do direct primary care. I just had a new physician join me this year a couple months ago, so she's building up her panel as well now. She's also a mom, so it's we have an entirely mom-run practice. Both
Love
of the
it.
doctors are moms. My VA is a mom. My in-person
Yeah.
assistant's a mom. We're all moms, which is chaotic at times because everyone has kid things come up at various times. But it works because we're flexible. Um, and yeah, so we see, I see all ages. My partner is an internist, but I see a lot of patients who are in recovery from disordered eating. That's sort of my area of interest. And then my partner does a lot of perimenopause care.
Oh, nice. So where can they find you?
So my practice is vitafamilymed.com, so Vita Family Medicine in Sugarland, and I'm on Instagram and TikTok at Rebecca Berens, MD.
All right, great. And she is wonderful. Go follow her. Look up her practice if you are in Sugarland. If you want beautiful direct care outside of your lame ass insurance, it's so much better.
For so much better.
All right. Rebecca, thank you so much for coming on and sharing your story and all of your wisdom. It was an absolute pleasure.
Thanks so much for having me.
Yes. All right, Doc. I will see you next time on another episode of Stethoscopes and Thrillers. Bye.